if it was not for my mammogram, I would not have found out early. And it's so important. And I was one of the women. I have dense breasts. So between the mammogram and ultrasound, I was very thankful. My radiologist said that it was just so tiny that she just had to go back and look again. So it just goes to show the importance when you do have dense breasts, how important it is to make sure that you are getting those screenings and you are following up to get that ultrasound. One of the things that we do, particularly if you are a very busy person, is that you put everything ahead of yourself. And this is one of those times where you have to put yourself first.
Screening is exceedingly important, especially in young women. We know breast cancer is on the rise in women in their 30s and 40s in the United States, and mammography is really one of our best tools at detecting breast cancer very early. By the time you can feel a breast cancer, it may be about 2 to 3 centimeters, which means it's usually a stage 2 breast cancer, which is vastly different from a stage 0 breast cancer. So it's very important to go for annual mammogram and ultrasound if you're dense breasted every year after the age of 40.
Reconstruction is always easiest when we are dealing with patients that are early stage. When women have more advanced forms of breast cancer, things become complicated because they sometimes need chemotherapy, sometimes they need radiation, and those are things that can make surgery and recovery more challenging. Follow the guidelines when it comes to screening because early detection is important and can make a difference. Not only can it be life-saving, but it can really improve the outcome and the experience of having to go through the journey to cure your cancer.
Again, it's a roller coaster. It depends on the moment when you catch me, how I'm feeling. There are days where I'm like on top of the world, and other moments I'm like, oh my God, this is really happening to me. But overall, I'm hopeful. I'm grateful. I have a very supportive family, friends. My DPH family has been very just gracious to me and understanding that I need some time to kind of figure this out, get rid of the cancer, then heal from it. So I think the overarching feeling is just grateful, loved, hopeful, with maybe a scattering in here or there of a little bit of anxiety about what's to come.